Hello and welcome back for another week. This week we are going to be talking about chemical dependencies, substance abuse, and addictive disorders. But what I would like to start with is just addiction in general. Later we will discuss specific substances. So addiction is a #1 health problem in the USA. It is an equal opportunity disease, which means that it affects all socioeconomic, racial, cultural individuals equally. Alcohol is involved in 60% of all fatal accidents and 50% of suicides and homicides. Also, it contributes 56% to domestic assaults. Psychiatric and medical comorbidities are substance abuse, as we have talked about several times. Oftentimes people with mental health disorders will abuse some substance to try and alleviate their symptoms. Often associated with polydrug use, dual diagnoses, and obviously psychiatric and medical comorbidity. Approximately 6 out of 10 people affected by substance abuse disorder are also affected by a mental health illness. Individuals who abuse alcohol are more likely to abuse other substances and vice versa. So if we want to discuss some basic terminology, addiction is a disease. It's a compulsive, uncontrolled craving for and dependence on a substance. There are different degrees of cessation, and it can cause severe emotional, mental, and physiological reactions when a person tries to get off the substance. Drug addiction should be considered a complex disease of the central nervous system. It's characterized by compulsive, uncontrolled cravings for and dependence on a substance. Now, chemical impairment actually means it's a term used by healthcare providers to describe behaviors related to the effects of the drug or substance on a person's performance. So if they're impaired because of the substance. Dependency is a reliance on a substance that's reached a level that its absence will cause impairment of function. Okay. Codependence usually refers to the dependence of one person on another person who is addicted. Drug abuse is an overindulgence in and dependence on a substance. And drug misuse is use of a drug for the purpose other than what it was intended for. So somebody might be prescribed medicine for ADHD, and that parent perhaps of the child who has the ADHD might use that medication or sell it because it does have the opposite effect on adults, and so they may be misusing the drug. Okay. Tolerance is something as a term that you're going to want to remember. Tolerance is decreased effect of a substance resulting from repeated use. So the more that somebody uses something, the body will build up a tolerance and require higher doses to receive the effect that they want. So remember that term, tolerance. So what is going on with addiction? What is the neurobiology of it? So within seconds of entering the body, drugs cause this dramatic change in the synapses of the brain. And it does this by bypassing the 5 senses and directly activating the brain's reward system, which is the dopamine, right? Dopamine is the reward center of the brain. Normally, dopamine is released at a slow rate, producing normal mood. But certain drugs increase the release of dopamine or decrease its reuptake in the synapse, okay? The increase in dopamine leads to that feeling of euphoria, that strong motivation to repeat the experience, okay? Addiction results from the prolonged effects of drugs on the brain. So repeated use of drugs remodels those neural circuits, or they learn differently for that. Hold on a second. My son's calling me. I'm just going to have to pause for a minute. Okay, sorry about that. So again, addiction results from the prolonged effects of the addictive drug on the brain. Repeated use of the drug remodels those neural circuits and reduces the responsiveness of the receptors. So therefore, this decreased responsiveness leads to tolerance and the need for larger doses of the drug to obtain that euphoric feeling. As drug abuse results in levels of dopamine that do not naturally occur, it also reduces the sense of pleasure from experiences that previously resulted in positive behaviors, such as food or relationships or sex, okay? So without the drug, the individual may experience depression, anxiety, irritability, the cravings are another characteristic of addiction. Cue-induced cravings, which occur in the presence of people or places or things that they associate with that drug use. New studies indicate that these encounters produce surges in the dopamine levels, and these surges push the individual toward actively seeking drugs out or taking drugs. So cue-induced cravings may occur after long periods of abstinence, and it is a common cause of relapse in people who are trying to abstain from use of the substance. So you can kind of think of this back to your psychology days with the Pavlov's dog, right? So whenever the bell would ring, we'd give the dog a treat. And pretty soon the dog associated the bell with the treat and would start to salivate, right? And the same thing happens with drugs. So if somebody associates a group of people and they always do drugs together, it is after some time, those people are going to be associated with that feeling of euphoria, and just having the people present is going to cause that craving in that individual and that need to do the substance with them. So this box basically is just some guidelines on what things we're going to be wanting to assess in our patients looking for substance abuse. Assessment should be across the lifespan. Again, it is an equal opportunity. Therefore, it affects all ages and all groups of people. So we're going to want to do this screening assessment with each individual that we come in contact with in our practice. For the client's safety, any suspicion of alcohol or drug abuse should be explored and reported because of the potential for a cross tolerance. Current alcohol and other drug problems can be detected by asking basically two questions. In the last year, have you ever drank, or used drugs more than you meant to? The second question is, have you felt you wanted or needed to cut down on drinking or drug use in the past year? Any questions any questions asked should be in a matter-of-fact way, non-judgmental. You should make sure that they understand that there will not be any legal ramifications, that this is confidential information and you're trying to obtain it for their well-being and safety. Many people have a fear of legal ramifications, so if you make that clear to them, they may be more open to sharing information with you. You need to try and get out of them specific details, which, like including the specific drug they're using, the route they're using it, how much, when was the last time that they used it, and their usual pattern of use. Responses that would indicate red flags for you would be things like rationalizations, like um, the patient might say something like, well, you'd smoke dope too if, okay? Or any automatic responses, like if they were expecting the question to be asked, they might say something like, well, I figured you'd ask me that. Um, and then another red flag would be slow, prolonged responses, as if the person were being really careful about what they would say to you. If the patient is unable to provide a drug history, the nurse should assess for indicators of substance abuse other than their verbal responses. Physical signs of abuse would be dilated or constricted pupils, abnormal vital signs, maybe needle marks in the arms, if the person is exhibiting some tremors, obviously if there's alcohol on the breath. And then a history. Is there a family history or history of friends using abuse or using substances in an abusive way? There is a very strong genetic connection between addiction in family lines. As a matter of fact, it's predicted that if a couple has 4 children and one of the parents has an addiction problem, it's predicted that 1 out of those 4 children will have the addictive gene and carry on that addictive behavior. Another thing is the clothing should be checked for any drug paraphernalia, such as syringes, crack vials, any like white powders, razor blades, bent spoons, and pipes, of course. And finally, we can do a blood alcohol content or a drug screen of the urine to get some uh, uh, objective information on any substance abuse. So psychological dynamics of dependence. There are many, many defense mechanisms that people will use if they are abusing some sort of substance. Usually these defense mechanisms are an unconscious process to ward off any anxiety or prevent awareness of threatening feelings in themselves. So they'll use these defense mechanisms to try and unconsciously justify the use of the substance. People use defense mechanisms all the time in our normal lives and to keep ourselves healthy and to protect ourselves, but some of these defense mechanisms actually, can be detrimental and keep a person from realizing that they have a problem. Denial, rationalization, blackouts, this, euphoric recall where they only remember the good things about an episode and they don't remember the bad things, like they remember how fun it was to party, but they don't remember that they were puking in the bathroom, something like that. Behaviors that will come out of negative behaviors that will come out of addiction problems are anger, depression, having difficulty with relationships, inability to control their impulses. They may be very manipulative. Oftentimes they have a poor self-esteem of themselves, and they may have, this perfectionistic kind of tendencies. So general nursing interventions, what we're going to want to do at the primary level is that we want to be doing health teaching. It can have, the health teaching we can think of targeting children or adolescents, the impact on how children and adolescents problem solve and have the understanding of the negative effects of these things will keep them from, hopefully keep them from participating in this as they grow older. Young people who participate in groups such as scouting and 4-H clubs or any organized kind of activity are at a lower risk for abusing substances. We would want to be, practicing activities with them that help develop self-confidence and self-esteem, because we do know that low self-esteem is a risk factor for substance abuse. So older adults experience stressful life events and are at risk for substance abuse also. So these populations we may want to reach out to in the community through social or spiritual groups and organizations to try and provide some education with them. So secondary prevention, remember secondary prevention is screenings or identifying problems early so that we can intervene and resolve them. So if you think of identification as a secondary prevention, the nurse can play an important role in the process by recognizing the signs of substance abuse in our patients and or family members, and being familiar with resources available to help these people overcome this addiction early before it becomes a chronic problem. Tertiary treatment, again, tertiary is where we are managing an already chronic problem. So the aim at the tertiary level is treatment, self-responsibility, and compliance. So inpatient or outpatient care depends on costs and the availability of insurance coverage, but outpatient programs work best for people who have substance abuse disorders, who are employed and are involved in social support systems. People who have no support or structure in their day may better be managed in an inpatient program where until they can develop these other coping mechanisms for the outpatient program. Relapses are very common during the person's recovery. The goal of relapse is to help the individual learn from these situations so that those periods of sobriety can be lengthened over time. You can almost expect that relapse will occur. And we try to explain to the individual that lapses or relapses are not viewed as a total failure. They're just a setback, and try and get them back on the positive track to recovery. We don't want to let the person wallow in failure feelings. That will only precipitate that abuse behavior. So some specific interventions would be use of brief interventions that would affect behavior change, and that would be like giving them feedback on how the substance is a personal risk to them, giving them feedback on responsibility that they have, personal control over the situation, giving them advice to change, being empathetic with our counseling, and helping the person be optimistic about this change. Counseling and support should be encouraged for all family members of the dependent person. So these are some basic things that we can target for substance abuse. The next lectures will be talking about specific substances and how they differ.